Okay, thank you. I didn't ask you how much time you wanted me to take, but I'm going to do a short presentation, show you some tools that you can use to compare Medicare Advantage plans, and then hopefully there'll be time for some questions as well. Okay, so we are focusing on Medicare Advantage plans this evening, and not because we love Medicare Advantage plans, but because it happens to be open enrollment for Medicare Advantage. So between now through December 7th, you're able to take a look at the plan that you have today and what other plans are available and make changes that are effective January 1st of 2024. So that's what we're going to be focusing on. I can still answer questions about, supplement plans and Part D plans, but that's where we're going to be focusing. Let's see. Oops. Okay, hold on. I jumped ahead on my slides. Okay, so first I wanted to share some things that are specific to our Linn and Benton counties for 2024 that everybody should be aware of. You may have already heard about some of these things, but they're really important considerations for choosing either going with your current plan or choosing a new Medicare Advantage plan for 2024. And the really big one is that Samaritan has made a decision to not renew their contract with United Healthcare for 2024. So what that means is that United Healthcare has Medicare Advantage plans, both HMOs and PPOs. HMO means that you have to stay within network to get coverage, typically. PPO means you can go out of network, but when you go out of network, you'll pay more, usually, for that care. So starting early January, Samaritan hospitals will no longer be in network for United Healthcare plans. And most of the United Healthcare plans, there are some that are like PERS, but there's also the AARP. Those are the ones most people know. So AARP, United Healthcare, Medicare Advantage plans will not include Samaritan hospitals in early January. And then later next year in November, Samaritan clinics and other Samaritan private providers will also be out of network for United Healthcare. So that's a big change. We have a lot of people who have been coming in. I'm also a Sheba counselor. I'm not here representing Sheba this evening, but we have a lot of people who have United Healthcare plans who have found themselves needing to switch to a different plan so that they can be in network with their Samaritan providers. Another local issue surrounds the Corvallis Clinic. There is a Medicare Advantage plan available in Benton County this year by WellCare. It's WellCare by HealthNet. They have a new PPO zero premium plan that's a very attractive looking plan for many people. However, Corvallis Clinic has said that they're dissatisfied with the way that HealthNet pays claims and are talking about being out of network for WellCare in the future, for HealthNet in the future. According to HealthNet, according to WellCare, they have a contract with Corvallis clinics that goes at least through the middle of next year. And Corvallis Clinic has not made any statements to them about not renegotiating their contract or not renewing their contract. So that's just something to be aware of. the one new plan by HealthNet in Benton County and Lynn County is like I said, it's called the Open PPO plan, and it charges the same co-pays for in and out of network. So even if the Corvallis Clinic decides not to renew their contracts, as long as you have a PPO, the preferred provider plan, and not an HMO, you would still be able to see your Corvallis Clinic providers, but you would possibly have to pay a higher cost for some things. There are some local pharmacies that aren't in network for all the plans. So you really have to know which plans have which pharmacies in network, if that's something that's important to you. So some of the people we talked to, for example, Rice's Pharmacy or Philomath Family Pharmacy, some of the smaller independent pharmacies in the area are not in network for some of the plans. So that means your drugs could cost you more or not be covered if you need to get them there. I talked about the new WellCare by HealthNet plan for 2024. It's called the No Premium Open PPO. Yeah. That's something to be aware of. And a change to the Samaritan Advantage plans for next year. Samaritan Advantage has 2 levels of Medicare Advantage plans. They have a premium and a premium plus, I think is what they call them. And the premium, the lower cost plan, is $19 a month. The higher one is $100. I don't remember the exact amount, but it's over $100 a month. With the lower cost plan, will be starting next year, 2 tiers of providers that are in network. Both are in network, but there's a gold tier and a silver tier. And your provider, if your provider is a gold tier provider, your copay will be lower than if your provider is a silver tier provider. So they might still be in network, and it is an HMO plan, but you would pay a little bit more for the silver tier. So those are some of the things that you just need to be aware of as we walk down this path, just to make it a little even more confusing than it already is. Did somebody have a question? No. Okay.
Just chuckling.
Oh, okay. Yeah. Yeah, it can be really difficult to compare plans because every plan has different pieces and parts to it. So I'll kind of show you what that looks like in just a few minutes here.
We do have a question in the room. So
okay. I'm not hearing you. I see that the owl is turning, but I don't hear.
I talked to Samaritan about their Advantage plan a while ago, and in their literature, which I had, it did mention this gold to silver thing, but nothing in the literature anywhere explained what that meant. So I called and they said, well, basically the silver plan is the Corvallis Clinic. That's what they told me.
Well, yeah, you'd have to look at each provider, but in general, what I've been finding is that if they're a Samaritan provider, they're gold tier. If they're a non-Samaritan provider, they're silver tier. That's in general, that's what you can find. So a tool that I want to show you how to use, because I think it's really a great tool for doing your research before deciding whether to renew your current Medicare Advantage plan or to get a new one, is this Medicare.gov. And anybody can get on Medicare.gov and look up plans. And I'm going to show you a little bit how to do that. But I would really encourage you to set up an account on Medicare.gov if you don't already have one. And what that does for you is that it allows you to put in all of your prescription medications one time, and then it'll save them for you. It'll also show you what your current plan is, and it'll compare your current plan to other plans.
Linda,
So it'll be a more personalized experience if you actually set up an account and log in.
can you hear me?
Now I can, yes. Yeah, Mike, I can't hear you anymore. I'm not hearing you, Mike. Are you talking?
Yes, we need to have you reshare your screen.
Oh, okay. Can you see it now?
Yes.
Okay. So I'm going to flip back and forth here between the Medicare.gov website and my presentation here so that you can see what I'm talking about. So can you see that Medicare.gov website? Okay,
Yep.
good. So if I had a login, I would go here and I would put in my username and my password, and I would log in, and it would show me everything I already had set up there. But since I don't have one set up, and since even if I did, I probably wouldn't want to show it on a screen in front of everybody, I'm going to do this without logging in. It also tells you here how to create an account if you don't already have one. So this is the home page. If you just type in Medicare.gov, that's all this site is. And it's open enrollment now to December 7th. And you can just say find plans. And then it gives you the spiel about save time by logging in, which is what I've already talked about. We're going to look at coverage for 2024. We're going to put in the zip code 97330. And we're going to say we're looking for a Medicare Advantage plan. Now, you can also use this to look at just a Part D plan, if that's what you're looking for, or to look for a Medigap or a supplemental plan. But tonight, we're just going to talk about Medicare Advantage plans because that's what the open enrollment period is all about. And say find plans. It asks whether you get help with your costs from one of these programs. And if you do, it's important that you select that. I'm going to say no for now, just to keep it a little bit simpler. And we want to say, yes, you want to compare your drug costs. Now, some people don't have very many prescription medications, so this may not be as important to them, but it's a big part of what Medicare.gov does for you. So now I'm going to go back to my presentation here for a minute. When you're entering your prescriptions, it helps to have your prescriptions handy because it's going to ask you about your dosages and how often you take it. And for the exact, you'll want to know the exact name of the drugs that you're taking. So it's useful to have those ready when you're going to compare plans. You don't include your over-the-counter, compounded, or Part B drugs when you're entering your prescription drugs in Medicare.gov. Part B drugs are those drugs that you don't administer yourself. So, for example, if you get any kind of drugs that are infused, that you go somewhere and they give it to you intravenously, that is a Part B drug, and that isn't covered under your medical. It's not covered under the prescription drug plan. Okay, so I'm just going to put a couple of names in here that you might recognize. So you'll start typing your drug in here and it'll come up with a list of matching drugs. You can click on that. So you've all heard the advertisements, I'm sure, for Ozempic. Add a drug. It'll show the most common dosage. It'll default to that, but there's other dosages that you might select from if they apply to you. So you select your dosage, and this is one package a month. And basically, I think this is like 4 doses. You do them once a week, but one package has all 4 doses, 1 pen. Not that you really need to know that. I'm going to add tramadol here. We'll say it's a 100 milligram capsule once a day. What's a really expensive drug? Flomax, is that one? I want to show you why this is. Okay, so this is something also to be aware of, is it'll tell you if there's a generic version of the drug. And you may be taking the generic or you may not be. Your provider may have specified for some reason that you need to take the brand name. Usually the generic will be less expensive. So this just tells you it comes in a generic version that may cost you less. So you can either add the generic to your list or you can keep the brand name. So for now, I'm just going to keep the brand name. Okay, so we've got our 3 drugs. I'm just going to put those 3 in to not make this not take too long. And we'll say we're done adding drugs. The next thing you do is you choose up to 5 pharmacies. And it's a good idea to use pharmacies that you would be willing to use, as well as your current pharmacies. Because for some plans, different pharmacies will be in or out of network. And you'll want to know that when you compare plans. And I'll show you this. There's a designation that just says LTC next to some pharmacies. Generally, you would not pick those pharmacies because those are inside of long-term care facilities. So I'm going to put in a few here. We're going to put in Rice's and say find pharmacy. So you can see here's LTC. So there's a Rice's pharmacy inside of a long-term care facility. That's not the one you want to pick. You want to pick that one. I would also suggest you always pick mail order pharmacy, just to compare what the cost is. We'll say, let's see, Fred Meyer. That one. And Costco. Probably the one in Albany. Let's see, we can add up to 5. So I'm going to pick one more. I'm going to pick Walgreens. Okay, so you can add up to 5 pharmacies. And again, I'll show you why that's important here in just a minute. So now we've got we've put in our pharmacies, we've put in our drugs. And the first thing it's going to do is come up with all the plans that are available in your zip code for the type of plan you selected. So you said we want to see all of the Medicare Advantage plans. So let's see. So you're going to get these search results, and if you are logged in, if you have an account and you're logged into your account, it's going to list your current plan first. If you're not logged in, like I'm not right now, I'm doing what's called an anonymous search. The default sort is going to be the lowest drug plus, or it says drug plus retail cost, but it's the drug retail cost plus your, what are they called? Your, the things you pay every month, your premiums. That's it. And then, you want to take a look at whether it's an HMO or PPO, and then there are other filters that you can use. So it shows the lowest drug plus premium cost. You can sort it other ways if you want to. That doesn't necessarily mean this is going to be the lowest cost plan for you, because it depends on how often you see your specialists, whether you see a hospital stay in your future, whether you're looking at worst case scenarios or not. So there's a lot of considerations when you're thinking about that. Now, this is not the new plan I was talking about. This is a WellCare, no premium HMO. You can see it gives you a star rating. It tells you what the monthly premium is. So this is a 0 premium plan. It tells you what it thinks your drugs will cost for the year. Gives you a health deductible, 0 deductible, drug deductible, and what your maximum out of pocket is. So that's a lot of information right there, just about that very first plan. And you can see that it's showing 10 of 26 plans. That's a lot of plans. So sometimes you might want to reduce the plan types down a little bit, or put other filters in. I talked about there are 2 different kind of plans, HMO and PPO. HMO plans tend to be less expensive, but that's not always true. There are some 0 premium PPO plans. But the PPO plans gives you a wider range of providers that you can see. The other thing you can do is can say you want it to definitely include drug coverage, for example. You can say whether you want to see special needs plans. If you pick a insurance carrier, it will only show you the plans for that insurance carrier. Unfortunately, you can't select several of these, and you can't exclude any. So that's unfortunate. That's one of the things that doesn't do very well. And then if you want vision and dental, which most of them have, hearing, you can click on those. So that didn't reduce it by very much. It's still showing us 10 of 21 Medicare Advantage plans. If we did want to see just the PPOs, just to get a feel for how this works, we could do that. And then we can see that there are 10 PPOs. So now we've reduced it a little bit further. And it shows here's the lowest drug plus premium cost is the WellCare, no premium, open PPO. Again, it's anticipating what it thinks your retail drug costs plus premium costs would be for the year. So let's see why that's so high, because that's a pretty high amount. That is for the full year. But you can, for any of these individual plans, view drugs and their cost. And this is going to be different for every plan. Every insurance plan has what they call a formulary. And the formulary determines how much your drugs are going to cost. Whether it's what tier it's in, whether it's generic, whether it's preferred. The other thing that's going to determine the cost is whether you get your drugs from an in-network preferred, a just in-network, or out of network. So for this plan, this is that WellCare PPO. Fred Meyer, Walgreens, Costco are all preferred in network plans, and Rice's is out of network. So if you were to use this plan, you would not be able to use Rice's Pharmacy to get your drugs. So here are the costs. The Flomax looks like it's a couple $100. Am I saying that right? Yeah, a couple $100 a month. The Ozempic looks like it's a little over $100 a month. The Tramadol, $3,600. So you can see where the drug premium costs are coming from. It breaks it down by pharmacy. But that's one of the reasons why it's important to put your drugs in, because the drug coverage can be different from plan to plan. So let's compare that, for example. Well, let's see. One thing I wanted to see is whether these drugs are even all covered, or if some of them are. Oops. Sorry about that. What I'm trying to find, and I know it's here somewhere, is which drugs are actually covered and if any of them are not. Let's go back to the search results. Oh, it says, I saw it. It just popped by. Here's another one, this Give Back Open PPO by WellCare. So you can, here's something that you can do. You can say, add that to comparison. We can, so this is United Healthcare. This is the plan we were talking about that Samaritan will be out of network for. So we're not going to include that one for now. Let's try the Regents. We'll add that one. And we'll throw a MODA in there just for fun. So you can compare up to 3 plans side by side, and it'll show you this comparison. So it'll show you what the premium is, monthly premium, the star ratings, if there's any medical deductible, if there's a drug plan deductible, what your maximums are in and out of network. So some of the things you want to look for that we were just showing on there. One is the out-of-pocket maximums. Out-of-pocket maximums are, again, that's sort of your worst case scenario. For a PPO, they'll have an out-of-pocket maximum in network and then a combined in and out of network maximum. So when we look here, the no premium open PPO is a little unusual in that the in and out of network, out of pocket is the same. So there's just one out of pocket for that plan. It's $3,450. This Regents is $9,550 in and out of network, $6,200 in network. And the MODA is pretty close to that as well. So that tells you how much you would have to pay out of pocket before they would cover 100%. This just compares the plan features. Most of them are pretty much the same. There's a few differences as far as the additional benefits, but all three of these cover vision, dental, and hearing, and most of them do. Most of them have a fitness benefit, a worldwide emergency, some over-the-counter drug benefits. Here's where you'll see another difference in and out of network costs. So here's your primary doctor visit. On this plan, when you go to see your primary care physician, you have a $0 copay. There would be no copay. For the Regents plan, if you're in network, you would have a $0 copay. If you were out of network, you would have to pay 30% of the cost of that visit. If you're in MODA, if you're in network, it's $0. If you're out of network, it's 50%. So you can see there's a big difference as you go along here in what you would pay. And only you know, and you may not know either, but you do know if you already have some specialists, like let's say you have a heart specialist or a dermatology specialist or that you see multiple times a year. You can start to calculate the difference in the cost between these different plans. So for example, here for a specialist visit, you pay $30 per visit, whether it's in or out of network. For the Regents plan, you pay $35 per visit if it's in network and 30% of whatever the cost is if it's out of network. And for the MODA, $35 copay for visit in network, out of network, it's 50% of whatever the cost is. So quite a big difference in plans there. And you can keep going if you get if you have to have regular diagnostic tests for certain liver problems, MRIs. Emergency care is about the same. It's always covered. Doesn't matter if it's in network or out of network. Urgent care, this one has a $65 copay. This one has a $50 copay. This one has a $35 copay. So if you're someone who goes to urgent care multiple times a year, then that would be important for you to know that the copays are different there. Hospital costs, here inpatient hospital costs, and this is only if you're actually admitted to the hospital, not emergency care, but in network, $425 a day for the first 5 days on this plan, the WellCare. On the Regents, $395 a day for the first 5 days, and the same with MODA. And then $0 for all of the days 5 through 90. For out of network, on the WellCare plan, you'd pay 20% of the hospital stay cost per day for all the days 1 through 90, if you're out of network. Here, Regents, if you're out of network, you'd pay 30%. And out of network with MODA, you'd pay 50%. You can kind of see a pattern here. I'm noticing a pattern. Then you get to the extra benefits. Now, some people put a lot of stock in these extra benefits, like hearing aids and dental and vision. But it's important to note that most of these have caps on them, and those caps are not showing up here. So you want to really look at the plan caps. If you're interested, if this is something that's important to you and you're coming down to, one plan or another, that's something to look at. So hearing aids in network, $0 copay on WellCare, $6.99 to $9.99 copay on Regents, and $5.99 to $8.99 copay on MODA. And I think those are per ear costs. So per year is usually how they show those costs. And then if you're out of network, there's a coinsurance. Now, most of these have like a $500 limit though that they'll pay. So even though it says zero copay, and that's true, they'll still only pay up to $500 per year. Same with the dental. Most plans cover between $1,000 and $2,000 per year at maximum in dental. So after that, you pay everything after that, even if you don't pay anything for your annual exams. But they do only cover up to $1,000 or $1,500 or $2,000. So if that's important to you and you expect to have a lot of dental coverage, you want to look at the specifics on that. There's wellness programs, transportation, skilled nursing facilities, which don't get me started on that, because you have to find one that'll take you and that takes your insurance, and you have to get pre-authorization. So that's been a real problem for some of these folks. Down here it shows in each case, only one of the 3 drugs we put in is covered. So that's why it's so expensive. So I bet if we change that Flomax to a generic, it would be, the drug costs would go down quite a bit. But you can see here the different drug costs based on which pharmacy you use for each of the different plans. You can print these out. You can look further at the plan details from here. So again, shows the deductibles, the costs for different types of services, ambulance, physical therapy. That's another one you might want to look closely at if that's something that you tend to have a need for. So here, in network or out of network, $30 copay. Here's our drug coverage. And I don't think these give you any specifics. No, it just says advanced plan approval required. That's those prior authorizations. Here's some vision coverage. And then those star ratings again. And you can see more about where those come from if you're interested in that. So that's a lot of information really quickly. You want to look at the deductibles. You want to look at your networks. If you have providers who you've been with for a long time, it's a good idea to call them or call their office and find out if they take that particular plan. You don't want to find out after you've already decided on which plan you want. You want to look at the deductibles, your cost sharing for PCPs, inpatient might be important to you, ER and urgent care cost shares. When I say cost shares, I'm talking about those copay or coinsurance amounts. Look at the prescriptions, if they have quantity limits, if they have prior authorization limits, they have step therapy requirements that say you have to try certain things before they, I don't remember exactly how that goes. I think it has to do with how you reduce your dependence on certain drugs, especially painkillers. The annual maximums, as I was discussing, for dental and hearing, for vision, for physical therapy, the number of visits you get per year for alternative care, and then for your other. Sometimes you have to dig deeper to find out So this is all, we've never left out while we've been doing this, we've never left the Medicare.gov page. But you can also go to the plan's website to see some of the more specific coverage limitations. So we can do that if you're interested, just to show you. But first I wanted to stop because, like I said, I know that's a lot of information, and see if there are any questions or comments about what I've shown you so far.
Questions for Linda? And right now we can't see the folks on screen. That'll change in a minute, but speak up if you have.
I don't see any hands up. I can see the folks on the screen. I don't see any hands up.
We have a question in the room. Okay.
What about mental health? Mental health coverage?
Okay, yeah, that is, let's see, that's one of the services that, that's fine.
If you want to share screen. you'll
Oh,
need to-
did it go away again? Doggone it.
That was at our end.
Okay. That's all right. Okay, so I'm looking. There we go. You have to, so you have to expand to find that. So mental health services, so for each plan, it'll show you the in-network and out-of-network co-pays for different individual therapy and group therapy, as well as opioid treatment programs services. So it does show those coverages as well.
Click on one of the limit supply, down button, down arrow.
Let's see, it might not give any specifics. Okay, this one says that advanced plan approval is required.
It's pre-authorization, right?
What's that? What was that, Mike? You can also go to the plan website. And I know I'm taking up a lot of time here, so you can shut me down whenever you need to. But if we look here, HealthNet Medicare plans. So here's where you could find out what providers are in network. You can look at their dental coverage here in more detail. I'm just going to do this real quick so you can see. Oh, no, that's not what I meant to do. I just wanted to say you are. So we were looking at this one. So this gives you more specifics. For example, on acupuncture, it tells you get 24 visits per year. So this is where you're not going to find those details until you go all the way to their website, unfortunately. This is in alphabetical order. So if we look up chiropractic services here, 24 visits per year. Hearing services, up to $750 per ear toward hearing aids every year. see, I'm just looking for any other really interesting things. So here's a vision benefit, covers a routine eye exam and up to $200 for contacts, glasses, lenses, and or frames each year. So that's where you're going to see those specifics. But this isn't going to tell you for your, your drugs, how much it's going to cost. Okay. Well, I hope that was helpful and not too much. I tried to get the right balance of enough information and overwhelming information.
We've got a question in the room, Alex.
Yeah, can you hear me, Linda?
I can, Alex, thanks.
So I'm wondering, because a lot of these MA plans, it seems that's part of how they make their money is through denial of claims, or I guess denial of pre-authorizations. So I'm wondering, that star rating, is that, I mean, I remember we did a report on a CBO review of MA plans, and there was some deal where they were even not allowed to, they were finding rampant denial of claims, but they weren't allowed to include that in the star rating. So I'm just wondering, is that star rating, is that just like customer reviews? Or is that actually based on something like denial of claims, or, the other nasty things that they do to juice their profits?
It's primarily customer service. So here you can see some of how the plans are. You can get down to really detailed levels.
To reshare screen.
Oh. Stop that. There you go. So this is still, we're back on the Medicare.gov site, and you can see the detailed star ratings. So it's not based on, Alex, it's primarily based on feedback they get from customers.
They really don't mean anything, do they, Linda? Those star ratings?
Well, they mean something to the plans because they get bonus points and they get longer enrollment periods based on how many stars they have. So if you're a 5-star plan, you can enroll people anytime during the year. If you're a 4-star plan or under, then you're limited to the open enrollment periods.
I'm just thinking it's just.
And you also get, like I said, bonuses based on your star ratings.
I'm thinking it's just how well you play the game, your star rating.
Yeah, I think that's a good way to put it. And their star ratings also help them if they drop below a certain star rating, they may not be able to keep their Medicare Advantage contracts. So there is a point at which CMS will come in and say, unless you get your star rating back up, we're going to have to shut you down.
Warren George has a question.
Yes, Warren.
Hi, Linda. Thanks for doing this. My question is, I'm a little surprised that you went with the Medicare Advantage. I think that's increasingly popular, but I think people may prefer the Medigap or supplemental plans. Does the government gov site cover the Medigap and supplemental plans?
It does. That's a good question. It does. It doesn't cover them as well. And the reason why I specifically was focusing on the Medicare Advantage plans for this presentation is because it's currently open enrollment for Medicare Advantage. So you can change plans. If you have Medicare Advantage and you want to switch to a Medigap plan or a supplemental plan, that's a little bit harder to do. And you can't necessarily do it during this period of time. Or if you have a supplemental plan and you want to change supplemental plans, usually you can do that like during the month of your birthday, you get a chance to do that. But as far as just, going from a Medicare Advantage plan to a supplemental plan, that's not something that's simple to do. But I can, but there is an option to choose Medigap plans on the Medicare.gov site. So you can look at that and see how much those cost.
Do you have any, from your experience, because we know there are lots of folks, certainly lots of folks in our organization who would like to make a switch from Advantage to supplements or Medicap. Do you have any hints about how to go about that? I know folks who've tried, and if there's any pre-existing condition at all, they get turned away, it seems. But in your experience, that could be helpful, any tips for how to go about this? And I know I may be asking an impossible question.
Well, not impossible, but difficult. So what Mark is referring to is there's something called a guaranteed issue period. When you first sign up for Part B, for your Medicare Part B, you can select, you have a certain amount of time around your birthday when you become eligible that you can select, you can look at supplemental plans, and that's a guaranteed issue period. And during that guaranteed issue period, they cannot turn you away. They can't deny you coverage. They can't charge you more because of pre-existing conditions.
Wow.
And they have to cover all your pre-existing conditions. So that's the best time to get a supplemental plan. Now, it's easy to go from a supplemental plan to a Medicare Advantage plan if later on you decide that the supplemental plan's not for you. Supplemental plans don't have the vision and the dental and some of those extra things included, and you do have to get a separate prescription drug plan. The only other ways that you can go from, if you currently have Medicare Advantage and you don't have a guaranteed issue period, you can still apply to get a supplemental plan. And you can do that anytime. They will have you fill out a medical questionnaire. They will do medical underwriting. So if you have a pre-existing condition, they may say they won't cover your pre-existing condition for a certain amount of time. And they'll put other stipulations on it. So outside of your guaranteed issue period, it'll be a little bit harder, for some people much harder, to actually get a supplemental plan, but you can apply for a supplemental plan.
Okay.
And see what it would cost you.
And generally you would do that right around your birthday.
Not necessarily, no. That if you wanted to look at that, you can do that any time of the year. You can switch to a supplemental plan. It's just that it's the guaranteed issue that's the problem.
Right.
The other way there are a few other ways you can get a guaranteed issue period. One is if you move and out of the area of where your Medicare Advantage plan is. So, for example, let's say you're on the Samaritan Advantage plan. It only covers 4 counties, and you move to Portland. Now, just during the period, you get a 60-day period during which you can have a guaranteed issue to get on a supplemental plan. If your Medicare Advantage plan ceases to exist, it gets shut down by CMS, or it goes out of business for some reason, then you get a guaranteed issue period. You can go to a supplemental plan with guaranteed issue and not have to do any medical underwriting or take any medical tests.
Okay. Stan,
use other coverage, you can also do that. So if you have coverage through a spouse's employer and you lose that, then you can also get a guaranteed issue period.
Let's get close, Stan, because your voice is off.
Stan here in the room has a question.
Okay.
I was just wondering what the cost for a supplemental plan was.
They vary significantly. So there are, I'm going to open my book here real quick for this year and see. I know there are some that are probably the least expensive ones are maybe $130 a month. Oh no. Okay. So it depends on what type of plan you get. There's all different levels of plans for supplemental plans. Some are as low as $107 a month. Here's one for $100 a month. One for, and then some for $153 a month. And it depends on your age as well. So those are some examples of the costs. They're typically a little bit more than a Medicare Advantage plan. But what you get with a supplemental plan is, first of all, there's no network. They cover any provider that takes Medicare. And then there's no copays, because for most of the plans that you would select for supplemental insurance, they pick up everything that Medicare doesn't pay. Again, you still have to get a Part D or a drug plan. And those tend to be around $35 a month for a drug plan. That's a good average. But the supplemental plan costs can vary significantly depending on which ones you choose.
Mike has a comment here.
Yeah, at age 80, I'm paying $250 for a plan G, I think it is.
Mhm. Okay.
Linda, you're motivating in two ways. One is to help us navigate the current situation. The other is to inspires us to do something far better than this very complex, confusing system that you've given us some insight on.
Yes. It's not, I can't tell you how many people, it's so difficult.
So I have two questions, if I may. I'll get up closer. First one is more specific. When you talk about supplemental plans and Part D and so forth, are you talking about traditional people on traditional Medicare or not?
Yes.
Okay, she just
So-
said yes. But I've lost my connection somehow. But
Uh-oh.
she answered your question, yes.
Okay, so if we're talking about Medicare Advantage, then we're out of traditional Medicare. Okay, now the second
Correct.
is, so then my second question would be, what is much more general? What is the kind of those Medicare and Medicare Advantage plans are essentially subsidized by the Medicare program. And so are there baselines? In other words, do all Medicare Advantage plans have to accept pre-existing conditions? Do they all have to, Medicare covers visits to the ER through a contract with private companies. I've had to deal with this a couple of times. But they pay the whole cost, which is, of course, a reduced cost from what they charge. So there are these baseline Medicare. Is this a kind of general baseline that all Medicare Advantage plans have to follow? Do you see what I mean?
Yes. So can you guys hear me?
Yeah.
Okay. So yes, the Medicare Advantage plans have to contract with CMS, with traditional Medicare, to be able to offer their plans. They do have to cover They are required to cover everything that Medicare would cover. Now, having said that, they can require pre-authorization, and they can put rules on those prior authorizations that Medicare wouldn't necessarily put on them. So, for example, if you're trying to get a pre-authorization for a hip replacement, they might require that you already had, they might want to see your MRI. They might want to make sure you've been through physical therapy, maybe that you've gotten cortisone shots, that you've done all of the other less expensive things before they will authorize that surgery.
In fact, that's the biggest problem with Medicare Advantage is pre-authorizations.
Okay, good.
Yeah, that's the big problem. And then they can also set their own copays. So their own cost sharing. On traditional Medicare pays 80%. And if you have a supplemental plan, it picks up the other 20%.
Right.
Period. With Medicare Advantage, there's like copays. Like you might pay 30% of what it costs, or you might pay $500 a day for hospital, and so on and so forth. So they get to set those rates themselves. Bobby?
Hi,
Hi, Bob.
I've, thank you very much. This must be an enormous job. My goodness. And to think about the prices of these things and someone sitting down and trying to figure out what they're going to need 12 months from now. Oh my, or 13 actually. It's 13 months you have to think through. 12 isn't enough. 13 months you have to see through. And, you know, it's just incredible. I just wonder why people don't say no. That's my reaction. And, you know, I was in another state and I had a stroke, and I was in a care facility for about 12 days or 14, I don't know. And I did have a plan, and I was told I would pay 1/4 the cost, and that's exactly what they charged me, and they gave me good service for it. And of course, I got a couple of letters from people in Chicago. I was in Indiana, fairly close to Chicago, but not that close. And they didn't say, they said, your insurance has paid us all they're going to pay us, but you still owe blah, blah, blah. And they didn't say who I'd seen, what I was seen for. And when I got the second one, I went to the numbers they asked, and I did get the company that I had been with, and they said, do not pay it, pay nothing. And so I did. And they apparently got to that ripoff outfit and put an end to it. So it was just very interesting. I saw maybe the better side of the insurance business. I have a Providence plan here through the university, which does help pay for it a little bit. They help me. But yeah, it's I think it's a nightmare, and you really got a good handle on it. Thank you very much.
You're welcome.
Any other questions?
Let me see if I can get up.
Yeah, we've got one more in the room here.
So this is very specific. I was told by a person who would know very much about this, that the clinic, my doctor, who is very good, is with the clinic. And I was told that they will, the clinic grandfathers in everyone who has traditional Medicare right now, but they will not accept any new. And then if that's correct, then my question would be, is to be selfish about it. What advantage would there be for me to go to a Medicare Advantage plan rather than staying in traditional Medicare?
So the issue with Corvallis Clinic, they have stepped back from their statement earlier this year that they would be non-participating in 2024. They have decided to continue to be participating providers for traditional Medicare in 2024. They're not making any changes. Now, having said that, they can say, an individual provider may say they are closed to new Medicare patients, period, whether you're traditional Medicare or Medicare Advantage. Just because they can't afford, is the way the conversation goes, to have too many people on getting paid for Medicare rates. That's another thing that universal health care would really help us with, is doctors would get paid the same amount regardless of what, who you were, instead of they get paid a lower amount for a really low amount for Medicaid patients, a little bit higher amount for Medicare patients, a higher amount still for private insurance patients, and so on and so forth. So they're incentivized to take care of people who can afford it. But that's my understanding of, based on our conversations with Corvallis Clinic, is they're not making any changes for 2024.
Right. My question though was, for me at 85 years old, what would be the advantage of switching from traditional Medicare to a Medicare Advantage plan?
I personally don't think there is an advantage. You might pay less money. If you, what's that? Yeah, you might save money in the short run, as long as you don't get too sick.
As long as you're in good shape.
But in the long run, boy, if you can afford traditional Medicare, it has a lot fewer restrictions on it, and you don't have to deal with pre-authorizations, and you don't have to deal with those co-pays and co-insurance and in-network and out-of-network and any of that.
We have one last question here in the room, and then we'll probably shift gears. But Stan, you want to probably need to come close to this.
I'm retired from the OSU. Get down and look at the. I retired from OSU, and I was wondering if there's a program that I could, if there's a program for me through OSU. I quit not about 15 years ago.
There is there are some special PERS plans, PERS. But if you didn't take them when you were first eligible, you probably would not be able to get back into them now. Once you go off of the PERS Medicare Advantage plan, you can't go back. So
I just want to throw in, as somebody who was in PERS and began using, when I retired, their plans, they turned out to be some of the more expensive plans out there. Really, we are doing, the threat was, and if you leave, you can never come back. Well, it turned out never coming back was just a fine idea.
I have heard that from many people, Mark. Many people say those plans are more expensive and you don't get any better benefits.
Right, I have one last question.
One more question and then we're gonna
I-
change
I've
gears
been
here.
told that if you're in an Advantage plan, you can choose to go back to Medicare. Is that correct?
You can choose to go back to traditional Medicare, yes. You may have difficulty getting a supplemental plan. But yes, you can go back to traditional Medicare. But a supplemental plan may be very expensive or it may be impossible to get, depending on your health.
Okay,
Find a doctor who will take Medicare.
yeah.
That's true.
Unless there's something else pressing, we're gonna move on because the evening is starting to wind on. Linda, thank you. This was just outstanding.